insights with us today. So thank you ever so much for joining. How are you doing, Kerry? How's your Monday going so far?
I'm fine. I was just saying to my partner today that I'd been saying to you a few weeks ago how I'm loving lockdown and more time with my 4-year-old, and my 4-year-old's going through major tantrums at the moment, and then nearly half my house fell down yesterday because the lintel broke. So it's been quite a stressful weekend. So it's so nice just to come in here today and do calls and webinars and coaching and stuff. So yeah, it's lovely. It's a nice change.
Good. Well, we'll get started. I'm just going to share my screen now so everyone can see our presentation. Okay. So yeah, the format really for today is an introduction to laser tattoo removal. We've actually been producing laser devices for 25 years, and one of the first devices we ever built was actually a Q-switch laser for tattoo removal. And things have changed obviously over time and developed, and so this is a pretty wide area to cover from a clinical perspective. So we are doing a tattoo removal masterclass, which is an entire day course. It's in a virtual classroom, so different to a webinar. You'd all be able to see each other and talk to each other and talk to the lecturer as well, who will be Dr. Sam Hills, our clinical director. Now, we've got one of these running on Thursday this week, so if anyone wants to do something above and beyond the intro, which is today, then that tattoo removal masterclass is going to be available for you to book onto, and I can send you all details of it after the webinar, so you can have a look at that if it's of interest. But we'll certainly try and give you a very good overview of tattoo removal today, particularly designed for people who are new to tattoo removal and want to work out, which perhaps might be the best technology. What kind of tattoos will you come across? Do they vary? Do you need to use different ways to treat different tattoos, etc.? And just go into that in a bit of detail this morning. So I'll just give you a very brief introduction to Lynton. We're a spin-off company from a university, actually Manchester University, been going for 25 years now. And like I said, one of the first lasers we actually ever built, Lynton, didn't exist. So it's just a bunch of physicists in the university sort of realizing that you could use a type of technology, a Q-switch laser, to remove tattoos and to remove pigment. And so they actually designed and built one of the world's first Q-switch lasers for tattoo and pigment removal. So we're like at the very, very frontier of technology at that time. And we're a medical device manufacturer, so we produce medical devices. And we also sell our lasers to different industries. And I just thought this was worth mentioning because exactly the same technology that we use for laser tattoo removal is actually used to clean buildings, statues, and old artifacts. So you can see this I'm not actually sure what you'd call that. Our conservation expert would know, but this is obviously a very ancient sort of sculpture, and you can see that some of it looks very black and some of it looks nice and clean, and those clean areas on there have actually been lasered. So you're able to remove the dark buildup of soot and pollution on these materials, really damaging. Oh, I think, Kerry, you might. Can everyone hear me? I've got a feeling that I might have just been muted.
Can you hear me, Hayley?
Yes, but I think.
Yeah, I seem to have disappeared. Can you get me back on?
Hang on a second.
I was just going to say that picture of you when I was in Athens a few years ago at the Acropolis, at the museum, they'd cordoned off a whole area, and they were basically lasering all the statues up on the Parthenon at the Acropolis and cleaning them all. And I was thinking, oh my God, I would absolutely love to try that. It would be so satisfying, wouldn't it? Just like sort of being able to clean things like that. But it's amazing because all the old statues on the Acropolis, in Athens, obviously, you know, get so much acid rain and pollution. Obviously Athens has quite a lot of pollution, so it's absolutely incredible the work that they're able to do. Ooh. Hello.
Hi, can you hear me?
I can hear you.
Right, okay. So I think in making you the host, so you could start your video,
Okay.
you've now put me on mute, I think, and I can't see the chat box from the audience to ask. So
Oh no!
if you can just unmute me, and then
I don't know how to unmute you.
if you go into panelists, sorry everybody,
Yeah.
I apologise, we'll get this sorted in just a second.
Yeah.
And if you can see my name in panelists, and if you just click to make me the host.
You're not in panelists. I can't. Okay. Lynton, more, make host. Oh God, sorry, Hayley.
Okay.
There you go.
Can you see me as an attendee?
It's saying that you're the host now.
Okay, so why
You're
can't...
definitely the host.
Right, okay, I'm back, I think. So everyone can hear me and see me. Yeah, okay, good. Right, sorry about that. It came up on my screen saying that I'd been muted. So I didn't think that anyone could see me, and then I lost control of the toolbar at the bottom, so I couldn't then see the chat. Don't know. Zoom having a little wobble today, hopefully. Let's carry on. Right, so
Are you able to get my video back?
you are on video.
Oh, okay. I can't see it, but that's fine.
When the it depends how you have it set up. So if you're speaking,
all
then
right,
you'll be
don't
able
worry,
to see
that's
yourself.
fine.
Okay, so we don't just do conservation lasers, but we also do surgical lasers, and we obviously specialize in aesthetics. So tattoo removal's changed massively. This used to be something that was done entirely on the NHS, you know, and it's moved completely to the point now where there's only a few sites in the UK that have commercial entities within the NHS hospitals still doing tattoo removal, and quite a low level actually happening there, and it's obviously boomed in the commercial private sector. So it's a really interesting area. Obviously tattoos are on the rise, aren't they? You know, absolutely, it's a lot more socially acceptable for people to have tattoos now, and the artwork I think is fantastic. You know, we're seeing all kinds of brilliant artwork come through, but alongside that, obviously we do have a lot of people that want to get their tattoos removed. So today we're going to talk through the different types of tattoo, selecting the right wavelength depending on what tattoo you're treating, and then just go through some tips and techniques for those. So the most common tattoo that you'll have present will be the, you know, the typical sort of professional ink that's been put on by a tattoo artist. And this is usually applied with a tattoo gun. There's a huge variety of types of design, obviously, and artwork that people can have done. Any area of the body can be tattooed. And with a tattoo that's been applied professionally, the ink is usually quite deep, and therefore it can take quite a number of sessions to remove it. On the other hand, you can also get amateur tattoos. So these are ones where people have actually sort of self-inflicted them. So they've used some India ink and a pin or a needle to actually tattoo themselves, which, you know, it's fairly common. You actually see quite a bit of this in clinics. Kerry, how often are you seeing amateur tattoos versus professional tattoos in your business?
Hardly ever, to be honest. Not very often. They're definitely more professional tattoos. I have had the odd person who's come in with amateur, but not very often.
Mm-hmm.
Not very often at all.
And how often do you get asked about semi-permanent makeup removal?
So it's becoming definitely more common. I think that's probably because there are a lot of practitioners now who offer semi-permanent makeup who may not be that great at what they're doing yet, and so I'm doing a lot of removals and corrections and things. I think there's just been an explosion in people who offer these services, and so yeah, we are getting a lot more interest in that. I have to say, more eyebrows than lips. In fact, I don't think we've had one this year for lips. It is definitely more eyebrows. So
And we're going to go through what the pros and cons are of treating these a little bit later. But a semi-permanent makeup tattoo is exactly that. So semi-permanent. So over time, your own body will actually break down the ink and will remove it. So they can be actually fairly easy to remove because of the way that the pigment is injected into the skin. But you can get colour shifts with that. So that's something you definitely need to be careful of if you're removing semi-permanent makeup tattoos in your business. And one of the other types of tattoo that you might come across is a medical tattoo. So for radiation therapy, sometimes spots can be placed onto the skin so that there are guidelines, and also for reconstruction of the areola as well. So there can be that sort of tattoo which you may be asked to remove. So we'll just go through then how tattoo removal actually works. So with a tattoo, what's happened is you've had the ink injected into the skin, and it's been injected in such a way that the particle size is actually quite large and very, very clumped together. So it's quite dense particles and they're quite large particles, and they're injected underneath the skin. And what you have is obviously like a dark colour. So a laser is perfect to remove a tattoo because you can get enough energy into that pigment to actually fracture it and break it down into much smaller sizes so that the body can go through phagocytosis and can remove those smaller particles of ink, but without damaging any of the surrounding skin structure. And that's because when you have a laser interact with the tissue, it's the dark, depending on the wavelength that you use, it's the dark colour of that ink, the reds, the greens, the blues, the blacks, which will absorb particular wavelengths. And as they absorb that light, it creates a photomechanical reaction in the skin. So you apply the laser onto the skin and it will actually just cause that pigment to rapidly heat. So it's actually it's not even photothermal, it's photomechanical. So it's rapid heating. It's like a shock wave going through the ink, and that causes the ink to fragment and break up. Now, before this, when it's just the tattoo in its natural state, the particle size is so big that the body just says, you know what, I can't break this down, I'm just going to leave it alone. It might fade over time, and that is the body just managing to break down some of it. But for the most part, the reason that they're permanent is that the particle size is just too big for the body to process. But when you can fragment the ink up into these tiny particles, then phagocytosis occurs. So this is where you have an immune reaction where you can actually see it just in this skin histology here. You can see sort of large clumps of pigment in the before, and then in the after 1 month image here, you can see them much, much smaller bits of pigment. And the phagocytosis has happened in that the white blood cells are coming along and helping to just remove those little bits of pigment, those pigment particles from the body. So I've been talking about tattoo removal for many years, but it always amazes me how well you can actually remove a tattoo. I mean, the results are fantastic, aren't they, Kerry?
They are amazing. I think I recently sent you, didn't I? I haven't actually posted it on my Instagram yet, but I sent you a photograph of, I sent it to Hayley saying, spot where the tattoo used to be, because you had to really zoom in on the picture to see, where it was on the arm. And that was all done with the Lynton, the AQS. So yeah, it's amazing. It's absolutely brilliant. And
I saw 2 this morning on Instagram. So there were 2. I saw Amy Jane. I don't know if you're in the audience, Amy, but I saw your result. That was a lovely one. And I saw Katie. Katie Ashton Thompson. I saw yours as well from the beauty editor. So just this morning I've seen 3 amazing results, and the skin is just left in a really good condition afterwards, isn't it? And we'll talk through exactly the stages that the skin goes through, but in terms of the other options that are out there, tattoo removal with a laser, it's leaps and bounds ahead of the other methods for removing tattoos, isn't it?
I would absolutely agree with that, but I would also say that it comes down to having really good equipment and knowing what you're doing with it. Because if you go in too hard, and I know a lot of this is covered in the masterclass, you can end up with hypopigmentation. And you know, it's about having the equipment that does the job, but also knowing how far you can push things and having the confidence to do that as well. Otherwise, you could end up with unnecessary. Because I've seen pictures before of, you know, where there's no tattoo there, but now it's just one hypopigmented tattoo. So
it's gone white. You take the pigment out of the skin.
Yeah.
And that comes down to wavelength as well, doesn't it? So choosing the right wavelength for the skin that you're treating, and for the colour of ink that you're treating as well. So unfortunately, there's not just sort of one laser that does it all. There are, as with all things laser and IPL, there are different wavelengths to target different colours of ink. So the reason for that is, and when we say wavelength, that's a different coloured laser, essentially. So what the mechanism that you've got to make happen is absorption. So you've got to get the ink to absorb the laser. And for that to happen, you need to have a colour match, so to speak. So if you've got a red tattoo, then a green coloured light, it will easily absorb. If you've got a green ink, then that will absorb really easily a red coloured light. So it's a process of absorption, and the more effective wavelength that you use will be determined by the colour of the ink that's actually in the tattoo. So if you have, and there's lots of options here, so you've got ND Yags 1064, these are brilliant for blue and dark blue, black tattoos. Now that's not to say that an ND Yag won't get rid of a red or a green tattoo. We have seen that happen, especially if it's a little bit of green surrounded by lots of black. You almost get like the shockwave reaction and the phagocytosis reaction in the area next door, managing to get a little bit of clearance in the surrounding area. But for the most part, if you've got your black and your blue tattoos, then an ND Yag at 1064 is ideal. And that 1064 number, that is the wavelength. It just refers to the wavelength, essentially the colour of the light. And then you can get an ND Yag, which is what we call frequency doubled. Sometimes this is called a KTP. These are all Q switches. So it's a Q switch ND Yag 532. And this is really good for red coloured tattoos. And so if you've got something like an ND Yag platform, they will often have both a 1064 and a 532 setting. So that one device will give you pretty good multicoloured tattoo removal. And I think I saw some statistics actually recently from the British Association of Dermatology that said that, you know, about 95% of tattoos are black. But that's changing, isn't it? I'm sure, Kerry, you've seen yourself the change in colours coming through nowadays.
Definitely. I think colour tattoos are definitely becoming more popular. And I think there is also the misconception out there that people have kind of heard of laser tattoo removal, and they kind of assume that now that, you know, they can just get any colour they want and anything can be removed. But as we know, there are certain colours that we can't, which we'll probably come on to. But yeah, it's definitely on the increase. So yeah, it's like fashions, isn't it? You know, in a few years' time, it will probably be more black tattoos. But at the moment, there's definitely a lot of colour tattoos.
Yeah, I think that one of the other factors as well is that if you have a black ink, that is very difficult to cover up. So rather than being able to go in with something that's like a baby blue, a light green, and ask for that to be covered up, that's not perhaps too tricky for the tattoo artist to do. But if you present to your tattoo studio with quite a dark tattoo, they have no choice other than to put something big and black on the top. So the ability to then fade that down you know, so most of the call that you get is for quite dark coloured tattoos for removal, isn't it? Because they're the ones that are more tricky to cover. And that's good, really, because as you start to move towards like green colours, as you start to move towards things like your very fluorescent blues, turquoises, they can be more tricky to remove. And wavelengths like the alexandrite at 755, and in particular the ruby at 694, so these sorts of wavelengths can be ideal for removing the green spectrum of colours. And I know you operate, Kerry, don't you, with a device that's got multiple options of wavelengths, so you can pick and choose what you want to treat whenever it presents.
Yeah, exactly. I think the only colour that I can't really remove is yellow. You know, very pale yellow won't shift. Even if it looks like it's reacting, it doesn't, you know, the process of phagocytosis just doesn't happen, even if you get a little bit of a reaction. And obviously white, we don't treat anyway, because that can oxidize and turn brown. So so yeah, and that's the difficulty, because if you get, I once had a guy came in with a big rose on his neck, which was black and highlighted with bits of white, but there was so much white in it. And of course you have to kind of steer clear of that. So it wasn't going to remove all the black because it was right butted up against the white. So, but yeah, it's always challenging.
Assessment of the ink is quite important, isn't it? We'll come on to that. How do you really look at the tattoo, and what questions do you ask to work out what kind of ink is in there, so you know which wavelengths to choose, which is the best way to treat. But yeah, as Kerry says, then white and yellow, don't treat. You won't get a great result on these. But the rest of the colours, you know, you will get a nice clearance of the ink. So when you actually perform the tattoo removal, it is quite normal to get a very audible click, isn't it? And we're going to, if you're in our tattoo masterclass on Thursday, we're going to do some live demonstrations of this so you can see it in action. But also a whitening of the skin and a bit of a nettle sting sort of reaction as well. And occasionally you can get some pinpoint bleeding. So Kerry, would you just talk to the audience about when you're likely to see pinpoint bleeding and how you handle that in the clinic?
Yeah, so first of all, some people do just, they're bleeders, you know, they will just bleed more. I mean, obviously we have to avoid things like alcohol, aspirin, you know, for at least 24 hours, any blood thinners, or if they're on warfarin, you know, they're going to be bleeders, so you wouldn't necessarily treat depending on, you know, what other things come up for them. But pinpoint bleeding is normal, and I think you have to prepare people for the fact that, you know, sometimes I do actually say, look, it's going to look a bit like a love bite, you know, sometimes, and it depends, you know, how far down the treatments you are. So the first treatment that you do, you're going to get the most audible click, the most whitening, powdering effect on black tattoos, and probably not a lot of pinpoint bleeding. But as you're narrowing down the beam to get those peak energies up, you're going to see more of that, more swelling, more pinpoint bleeding. Most of the time it tends to happen under the skin, and it tends to stay under the skin. You can get a little bit coming through, but sometimes you can literally get a white tissue, pad it, and you get a few specks, you know, and that's literally it. But as you get down to maybe like the 2 mil spot size, then you would get a bit more bleeding, and basically you just, you know, wipe away and carry on. But it's never, I mean, I don't know about any guys watching, or maybe some of you are also tattoo studios, but I've actually gone in, I work quite closely with some tattoo artists locally, and I've gone in to watch them work, and I mean the amount of blood, you know, they're literally tattooing and wiping and tattooing and wiping. It's not like that when you're doing laser, but you will get a bit of blood, and that's normal.
And what you're referring to with the spot size there, Kerry, is when as the tattoo ink is, you're sort of taking the ink out in layers with each treatment that you do, and as you then get to say session 5 or 6, the ink then is quite deep, isn't it? So to get quite deep, you want a high energy, and to get a high energy, a smaller spot size is better, isn't it?
Yeah, absolutely.
larger spot size, but then when you want really superpower energy, you're going to have to bring your spot size down, your treatment area down a little bit, so that you can get to those maximum spot sizes, and that's when, you know, you can get more of the pinpoint bleeding.
Yeah, absolutely. And this is the thing, I mean, and I know in the masterclass it covers a lot of that and explains why, you know, you're getting high energies by reducing the spot, etc. So because, you know, if clients ask you, well, why do we have to reduce the spot size, you know, you want to be able to explain, you know, why you're having to do that, especially because it is obviously going to be, you know, it's going to hurt more as well. So they want to understand that there is a reason behind it, why that is, and that, you know, ultimately it's going to get them the result that they want to.
And we had a question from the audience, which is about using the ND-YAG. Can it be used for black and blue tattoo removal standalone, or does it need an attachment to make it a Q switch? So yeah, it has to be a Q switch when you do tattoo removal. Don't ever go down the route of IPLs or anything that's creating a thermal pulse. It's got to be a Q switch. And the reason for that is because if I just come back to this slide here, so you see how thick and dense and heavy that ink is within the skin. If you use any kind of long pulsed light source, so that would be a long pulsed ND-YAG or a long pulsed IPL, there is so much target in this big blob of ink that it will absolutely soak up that light. And because the pulse duration is quite long, that means the energy is going into it fairly slowly, and it has the opportunity to create a heat reaction, which then spreads out around the tattoo. So what happens is you actually end up causing a huge amount of heating outside of the tattoo in that dermis. So as a result, that can damage the collagen quite significantly, and it can lead to a scar. So you must be very careful when you're using your long pulsed lasers for things like hair removal and rejuvenation not to catch any tattoos, because you can cause so much heating and that can actually lead to a scar. So the difference with a Q switch is a Q switch actually puts the energy in a much shorter pulse duration. So rather than it being a long pulse duration, it's shorter. So long pulse lasers are usually in the millisecond range, and as you go to a Q switch laser, that's in the nanosecond range. So you've got a much shorter, sharper pulse. So it's super energy, still putting lots of energy into the tattoo, but it almost doesn't have time to heat. The heat is kind of used up in this explosive sort of shock reaction, a photomechanical rather than a photo heat type of reaction, or photothermolysis reaction that we get with, you know, when we use the long pulse lasers. So that Q switch, essentially it's a device within the machine which actually allows the energy to build and build and build and build and build, and it's like a shutter, shuts on and off, and a blast of high energy, very short pulse duration comes out, really high peak power. And that means that all of the action is in the ink and none of the action is in the skin around it. So you don't get that scarring, you don't get that interaction with the healthy tissue, you just get the tattoo fragmented up.
Which is why you can literally, you know, I don't personally have any tattoos. It's the only treatment that I do that I don't know what it feels like. And it's like when someone comes in with the tattoo, you know, you can literally laser their skin next to the tattoo and they won't really feel anything. As soon as you hit that ink, you know, you feel it because you have the absorption there. And I was just going to say quickly as well, I had a fireman who came in who wanted to have treatment for laser hair removal on his chest, and half of this chest, he had a big tattoo just on one of his up here, and of course just couldn't do it because, you know, you cannot laser. So if anyone's coming in for laser hair removal and they have a tattoo in the way, and I'm sure everyone knows this anyway, but we must not treat because you would cause untold amounts of laser burns. So
some good questions on picosecond actually, and let's talk about pico. So we do have experience, we're not currently selling a pico laser, but we do have good experience, and I think that picosecond laser tattoo removal is a really good step forward in terms of technology. So a picosecond is now even shorter pulse duration than nanosecond. So when we talk about a Q-switch laser, that really refers to a nanosecond pulse of energy, and picosecond is a picosecond, so even shorter. And what that means is you get even less sort of thermal spread, you get more fragmenting. What it really means is that if you've got an ink that's got incredibly, so even within a tattoo, you have particles of different sizes. You can have big particles of the ink and you can have really small ones. And a Q-switch is excellent at fragmenting up the large ones, but sometimes can struggle with the tiny pigments, and that can leave behind what's called a ghosting effect. So we'll look at that in just a moment. But whereas with a picosecond laser, then you can get a much smaller particle size treated. So the treatments should in theory be faster. You should be able to do less treatments within your course. So rather than 12 sessions, you may be down at 10, 9 sessions. And also good for pigment pico as well, because the pigment particles like pigmentation, they're quite small as well. The only I guess concern with pigment is that picosecond is the price of the devices. So the reputable devices on the industry, of which there are several, you are talking an investment level of about 80,000 upwards. I mean, they started at about 250,000, a few years ago when they launched. And they tend to be quite specialized tattoo and pigment platforms. So I think if you are running a business where you want to be like the market leader and you want to really specialize in tattoo removal and almost do like nothing else, like that's your speciality, and maybe you're in central London, then that level of investment might be appropriate. But we found that for most people, they were looking for something which perhaps was combined platforms with hair removal, that could be combined with skin rejuvenation, that would actually give good clearance. Because of course the problem is, if you invest at that level, the price that you need to charge to the end user is quite high. And our feedback from the market was that it's quite difficult to sometimes explain to somebody the difference. And so if you're charging £400 for laser tattoo removal and there's someone down the road charging £200 for laser tattoo removal, then that can be a bit of a challenge, can't it, commercially? So yeah, I think there's a place for it, but I think it's good to have both options. Q switches are very good if you want to deliver excellent results for tattoo removal. If you want to be really just purely tattoo, then picosecond might be an option for you.
And also, I know that when Pico very first came out, there were a lot of claims made that, you could get rid of a tattoo in 4 sessions, and actually that wasn't happening. And when you think about it, the process of phagocytosis, whereby you're breaking down, say, ink, and your white blood cells are coming in, engulfing it and carrying it away, that is going to be should be the same. And I know I've spoken to Sam a lot about this, because really, in theory, Pico shouldn't actually work that much better than a laser that works in nanoseconds. So, and I know that the tattoos weren't actually going as quickly. Obviously it will be a bit quicker, but I don't think it was as quickly as they, people were saying, oh, you could have one treatment and it'd be gone. Yeah. And that wasn't happening, was it? Yeah. So
our experience was about 20% less treatments with a Pico.
Right.
So it's a commercial decision, I think, really, whether you want to invest at that level. I'll show you the sorts of results that you can achieve with a Q switch, and they're amazing. You wouldn't see this ghosting left behind in the skin, would you, Kerry? It's
no. And the picture I sent you last week, there was nothing. You couldn't see anything there at all. I was just going to quickly ask a question to Joanne. What about the Alexandrite? So you cannot use any laser for tattoo removal unless it's Q switched. So it has to be Q switched, because if it's not Q switched, as Kelly was saying, basically you're creating a photothermal effect. So you're literally heating the target, whereas with tattoo removal you have to do a photomechanical effect, which means you're shattering the ink, which is what that click is. So no, unless it's a Q switch laser, you wouldn't be able to remove the tattoo.
Yeah. So just got some examples there of the pinpoint bleeding, and I'm not sure whether or not this, you can see here just like a tattoo being treated and some of the white bits actually on the skin as well there. And hopefully for those of you on the course on Thursday, we'll get to show you this live, but there's lots of videos on YouTube, isn't there, if no one's seen this in action before, just showing you how the tattoo removal works. If you do come across these amateur tattoos, then they respond really well. So you can see this is only 2 treatments, but that's because it's not a professional ink. It's been put in the skin quite superficially, and they will lift out really nice and easily. Whereas something that is a professional ink, as this one here is, you can see that this is 9 treatments with a Q-switched ND YAG laser. This is actually our Lumina device, and you can see you can't see any ghosting in this one at all, but sometimes you can see a little bit of ghosting. So I'll have a picture of that in just a moment. Kerry, we've been asked about the R20, which I know is quite a detailed subject, isn't it? Do you want to give people an introduction though to what the R20 method is?
So the R20 was developed by 2 doctors in America, and they literally got a tattoo. It was quite a big tattoo, and they divided it into quarters. And at the same sitting, they treated the first quarter just once, and then the next quarter twice. And I know you go into a lot more detail about how you do that and spacing and timing between in the masterclass, but as an overview, you literally can treat the same tattoo at the same appointment up to 4 times with a certain amount of spacing and cooling in between, etc. And then they brought that person back after 8 weeks or whatever it was, and the difference between the first quarter, which had only had 1 treatment, and the last quarter was really quite significant. So so the R20 is the ability to do more treatments in one sitting. And yeah, I do a kind of I don't do the full R20 in my clinic. I think it's quite intense on the skin, and I think it can cause some unnecessary hypopigmentation, which is where the laser's not just picking up the ink, the tattoo ink, but also your natural pigment, so it can cause unnecessary sort of white scarring. But if it's done correctly, with the following the right protocols, etc., it can be really good. And as I say, I do sort of an abridged version in my clinic, and it does definitely speed things up, and it's really, really good. And I would say as well, it's a really, because you do cover it on the masterclass, don't you? Yeah. How to do it, etc. If you've not heard of it, or you think you'd like to try it, I think it would be absolutely brilliant to do that, and for that alone I would do the masterclass, because it's quite involved, and it's kind of too long to explain here, but yeah, I've massively speeded up, for people who want to get rid of their tattoo as quickly as possible, like they've got a wedding coming up, etc. It's fantastic to be able to do, but obviously it's double the price. So when I do it, because I do 2 sessions in one, I don't tend to do more than that, it is double the price basically. So or if they're buying a package of 8, they're using 2 of their sessions. So it can be, for some people it's prohibitively costly, but yeah, if they just want it gone tomorrow, it's really good to be able to do.
It's quite an advanced procedure to do, so it's not something we cover in our normal training, but in the masterclass you would pick it up. And yeah, it's called the R20 method. So it's not specific to Lynton, but it is something that you can do with a Lynton device, which, as Kerry says, will enable you to get some faster tattoo clearance. And there's just an example here of a brilliant removal. What you can see if you look closely at the after picture there is a little bit of a change in the pigment. So you can see that you've got some of the normal skin pigment just picked up there, and a little bit of whitening, and not something I think you'd really notice on this lady day to day. But if you're doing a large tattoo, this is a risk, isn't it, Kerry? So how do you cope with this, and how do you minimize the chance of causing some hypopigmentation?
So basically, you have to tread carefully. So you always start at the lower ends and work up. Your spacing is crucial because if you've got, I mean, I've got two different laser tattoo systems, and they have different sort of rep rates. So if you're going to use a fast or faster rep rate, you've got to be really confident with your spacing, because if you don't move the device quickly enough, which means you're firing on the same spot unnecessarily, that can cause trauma to the skin. So it will pick up the natural skin pigment and cause possible hyperpigmentation. So, you know, whenever I get sort of new staff, I literally get them to practice their rep rates on a piece of paper to get their spacing absolutely perfect, so that you're not unnecessarily treating, you know, really hammering the skin in one spot. But yeah, it's about also selecting skin. Obviously, be very careful with your Fitzpatrick skin typing. For some skin types, you know, it is more of a possibility, and it's about sort of making sure that you cover that in the consultation, make sure that they're aware of it. Obviously not treating skin types you're not supposed to treat for certain colours and things like that, which I know, again, you go into in a lot more detail in your training. Keeping out the sun is absolutely crucial. So I only do exposed areas in the summer if I'm absolutely confident that the client is going to stay out of the sun completely. And if you get a client that says, well, you know, I'll try, it's like, no. It's either you can or come back in the autumn, because it's just not worth risking it. So yeah, basically it's about making sure that they stay out of the sun, choosing your skin type correctly, making sure you're not over treating, so not using too high effluents, looking for your clinical endpoints, being confident that you're getting the right reactions without needing to up that energy, and getting really good at your spacing, and just being comfortable with your machine and whatever the fastest rep rate is. I mean, you know, sometimes if you're running slightly late and then you've got a big tattoo coming in, you think, oh, I'll just up the frequency. Only do that if you're really confident you're not going to overlap, because that's when you can cause hyperpigmentation. And also some skins, I mean, she looks quite sort of irregular. I don't know, the second photo you can see kind of a bit more freckly. I mean, she does have a slightly more uneven skin type anyway, which is going to show up more with hypopigmentation. But yeah, so basically, in a nutshell, stay out of the sun, make sure you're confident with your Fitzpatrick skin typing, confident with the energies you're using and the rep rate that you're using.
I think even with the biggest will in the world, you're going to get a little bit of this every now and again, aren't you?
Yeah, absolutely.
And what's interesting is that, I mean, you shouldn't worry if you get this. It will repigment over time, so the colour will come back into that area. It will go back to normal of its own right. And in fact, Verity, who provided us with this image, is in the audience, and she says that she has seen the skin since, this lady since, and it has had a significant improvement. So that's good.
And a very little bit of UV stimulation will help, you know, unless you've absolutely blasted the hell out of, you know, your melanocytes, your melanin producing cells, and you really have killed them off and they are not going to release melanin again. With a little bit of UV stimulation, you can get that sort of color coming back a little bit. But obviously any areas of real hypopigmentation, you've got to be careful, because obviously, you know, you need to use sunscreen on that, because you're not getting the normal protection, so from the sun.
So this one is actually this one is only 2 treatments in. So sometimes you can see these. I thought this was an interesting picture to see, because I mean, first of all, it looks very impressive, it looks great, but just be wary, because this is actually a fairly easy tattoo to remove. And I see other manufacturers, and if you look closely at before and after pictures, you can really tell what level of removal there's been. So what I mean by that is, if you look at this ink, can you see how there's quite a lot of shading in it? So rather than it being thick, dark ink, there are certain places where you can see the ink is much thicker, much darker, and that's harder to remove. But this shaded bit, you know, there's a lot less pigment in there, so it does actually lift significantly more easily. So it's just worth bearing in mind, if you are considering devices, ask for a range of images, ask to see different types of evidence of different types of tattoo being removed. You want to see some nice thick dark ones in a good before and after that's been removed, rather than just one that's got lots of shading in it, because they're fairly easy to lift anyway.
I was going to say, shading is from a clinician's point of view, is so satisfying. It's because it almost vaporizes in front of your eyes. So I've had shading go in one session. It's fantastic. And then if a client is coming in with a tattoo like that, which in my clinic, would cost quite a bit to remove because of the size of it, you can say quite confidently, but it's going to go very quickly because a lot of it is shading, and then obviously you can readjust your price for doing more of the block work. So yeah.
There's an interesting point from Kimberly in the chat actually about different areas of the body healing at different times, and how you might proceed with caution if you're on ankles or wrists or things like that, to reduce chances of you having a poor result, so to speak. If the tattoo is further away from the heart, ankles and things like that, they can be a bit more resistant. Do you find that?
Yeah, definitely. So the further away it is from the heart, and again, that's covered in more detail and why in the masterclass, but the trickier it is to treat. So the best ones is some vibrant 25-year-old with one on his or her chest, right over the heart in black, perfect. But if you're going to get ankle ones on, say, a lot older, so if you get someone who's 60 who smokes like a chimney and drinks like a fish, and their immune systems are just not going to be the same. So yeah, they are definitely more tricky. I think I would say ankles are trickier than wrists. But on my Instagram, there's a one of the tattoos is actually a wrist one, and I literally got rid of it with the Lumina in 8 sessions. And we normally say 8 to 12 is kind of the average, and it went in 8. And for a wrist one, and she was Indian as well, so yeah, absolutely amazing, and no hyperpigmentation, so really good. So it can be done, but I would prep your clients to expect it to take longer for extremities.
Yeah, definitely. And so in terms of then the cosmetic tattoo removal, do you offer this in your clinic?
For cosmetic?
Yeah, you do. Are you doing eyebrow and lip removal?
Yes. Yeah, definitely. So yeah, and it goes a lot quicker than a normal tattoo because obviously it doesn't go in as deep. So yeah, we do a lot of eyebrows, I would say, than lips.
And what would you say is the percentage that you have trouble with in terms of colour shifting?
I've never actually had anyone that I can't remove it for. I would say one of the first questions I always ask for any tattoos is, was it done in this country? Because in this country we use British standard inks. I don't know about these semi-permanent ones, but and obviously sometimes if they're done abroad and they have some kind of plasticizers mixed in, which again I know is covered in your class, it looks like a simple black tattoo, but it's not going to shift. So I always ask that, but I've never had anyone with semi-permanent makeup who's not had it done in this country, and I've never had any that hasn't shifted. So.
But do you see the change of colour as you're going through?
Oh, I see. Did I just completely not answer your question? Off for one. So no, I actually haven't seen that. I have to say, even though I was able to do this for quite some time, I didn't actually do semi-permanent makeup for quite a long time, even though I was doing tattoo removal, because of this potential colour shift. But talking more to you guys and talking to Sam, etc., I just obviously there's more experience under the Lynton clinic belt as well, and I thought actually we're going to try this. So I haven't seen it, but I absolutely prep clients for this, that worst case scenario, because I know when I came to one of your master classes and conferences, there was a picture, it might even be this one actually, but about it changing to orange. And I do say to people, look, I've not seen it in here in clinic, but I know that it's a possibility that the inks can be quite volatile and unpredictable, and as such we just patch test the tiny corner of the eyebrow and we check for color changes, and just to warn them that it could, and worst case scenario, if you're doing the end of the eyebrow, they can just have it colored over again. But yeah, just prep the clients to say that it could turn orange basically.
So the ink can oxidize, it can turn this orangey color. In the lips, it's quite common for the ink to go a much darker color, so even a black. And obviously, to have someone look like they've got black eyeliner on, you know, around their lips, then that's going to be quite traumatic for someone. So it's really important that you consult properly, that you proceed with a lot of caution, that you test patch, and you can do this. And as Kerry says, you can get a lot of success in doing so, but I think it's really important to highlight the concerns of this happening for a client, isn't it? Heidi's asking, how long do you leave after a test patch before treatment for semi-permanent?
So it depends on the skin type as well. So for darker skin types, I always leave longer anyway. If it's going to turn a funny colour, you're going to pretty much see that instantly, because there's an instant sort of oxidization of the ink. So if you're leaving a certain period of time because you're concerned about ink colour changes, you're going to see that. Would you agree with that, Hayley? I mean, that's my experience anyway, of all the stuff I've learned. Anyway, as I say, I haven't actually seen this. So, but I would leave at least sort of, a week. I mean, you can leave, I think it's 24 hours for, certain skin types as well. So I think when it comes to semi-permanent makeup, I think I would leave some extra time, just because you just want to be absolutely sure, that the client's happy. They're not just coming straight in the next day and you're just doing the whole eyebrows. So and also, just quickly, I was going to say, sorry as well, don't forget, guys, that if you're doing laser hair removal, if they have got semi-permanent makeup on their lips, you need to leave I would leave, I mean, I think we say half a centimetre, but I would leave a good centimetre, which actually a lot of the time precludes you from being able to do the upper lip, depending on how big their upper lip is. Because remember, if you touch any of the red ink, it's probably going to go green and they'll end up with a green outline of their lip. So just be really careful if you're treating hair removal on the lip with semi-permanent.
So you can do tattoo removal on the lip area. I think it just takes like almost a bit like Kerry's done. Get used to removing your tattoos. If you're quite new to laser tattoo removal, then crack on with your tattoos for now, and add in that removal of the semi-permanent over time as you get more experienced and you get used to kind of assessing it. And if any of you are Lynton customers and you want to spend some time with one of our trainers during lockdown just talking about this in a bit more detail, or you want to join the masterclass, then we can go through that. But I do think it's an area where you want to be quite experienced with it, and some of our operators, they don't do it, some of them do. So it's one of those where you can get good results, but you want to be in a position of good experience, really.
Yeah, I don't feel bad that you're not doing it. I mean, as I say, I didn't do it for years, and even though I was training for you, so I was a very part-time trainer in this, I didn't feel confident, not because of my technique, but because of necessarily how inks might. So don't feel, just because the place down the road is doing it, don't feel any pressure to do it. Do it when you feel comfortable. As I say, I didn't do it for ages, so
So just talking about some of the other reactions that you can get then. So ghosting I've mentioned, and this is different to hypopigmentation. This is where you can actually get the sort of almost, you can sort of see the tattoo in places but not. So it's not 100% removed, but unless you'd known there was a tattoo there before, you wouldn't know there was ink there, would you? So no. Maybe it just looks like a bit of a dark shadow, sometimes. But in terms of patient satisfaction, then if you're using any of the Lynton devices, people will get enough clearance to be happy, satisfied that it will be life-changing for them if it's a tattoo that they want to get rid of. Pigment changes we covered. Yes, you can get some textural changes. So as you're going a little bit deeper, as we mentioned there towards the end of the sessions, then you can get some textural changes. And it may be that if you do have some fractional lasers that deal with textural changes, you would be able to just improve the appearance of that over time. But it is really rare for you to get that.
It is. If you're using the right settings, it is really rare. So
blistering is a bit more common though, isn't it, Kerry? When do you get blistering and how do you manage that? Blistering and swelling.
yeah, so this is the one laser treatment that we do where I almost tell people to expect blistering, whereas you wouldn't be doing that for hair removal. But it is far more common with colours, and when I say colours, I mean more red. So reds will always blister. They might not always blister on the first treatment, but going further down the line, they do. Blacks are not as common to blister, and certainly not in the first few sessions. But I do, I have a guy who's coming for quite a big one on his arm, and he is a blisterer, if that's even a word. He will send me photos afterwards of, huge blisters, but he knows not to pick, not to put Auntie Flo's magic potion for blisters on it. It is, I always tell people it's nature's elastoplast. Just leave it. The only time blistering is a problem is if it pops and if it gets infected. So I always tell my clients, and I know you go through all this in the training and your masterclass in more detail, but if it pops, you need to put like a breathable gauze over it to keep it sterile. But the main thing is not to freak out yourselves when you see these huge, because some blisters can be massive, and to prepare the client for that. So yeah, blistering is absolutely, if I saw that after a hair removal, I mean, that would be a completely different story. But for tattoo, it's fine. It's just important that the client's not freaking out, and that you're giving them good advice as to how to deal with blistering. Yeah.
There are some inks that don't respond to treatment. I don't know whether you've had many of these, Kerry. We haven't had a huge amount in our experience, but there are some, like acrylic inks, like a plasticky ink. Often they've not been applied in the UK. They're tattoos that people have had done on holiday when they've been overseas, etc. But these can be really quite tricky to get rid of, can't they? In fact, they just won't remove.
No, so I don't get many that have had them done abroad. And obviously I cover this in the consultation if they have been abroad, to say that there is a chance that they might not go. But I think you would see it as you go along. You just wouldn't get to the end of 12 treatments and go, oh, blimey, it hasn't gone. You would see you're not really getting very far with it. So
yeah, and not very often. This slide is showing some blistering. This is not normal. This is a very bad reaction, extensive blistering, and what we suspect has happened here is that the device that's been used has caused a more photothermal effect rather than a photomechanical effect. So we were talking earlier about long pulse lasers, about lasers that they're Q switch on paper, but because you can just buy lasers from eBay nowadays, they haven't gone through the appropriate regulatory checks, and therefore what might present as a Q switch could actually be delivering quite a long pulse and could cause this kind of overheating in the tissue and this level of blistering, and then therefore scarring. So the instance of genuine scarring from good tattoo removal treatments is less than 1%. It's an extremely safe treatment to use if you're using the right device, but unfortunately there are a few unregulated.
I would also say that quite possibly for that treatment they didn't use any kind of cooling. I mean, I've got a cryo in my clinic, and although I've been open 15 years, the first 3 years I didn't have a cryo, and it's one of those things, once you have it, you kind of don't want to treat without it, or even though I wasn't doing tattoo at the time actually, but if you're able to use a cryo at the same time, it makes a massive difference in terms of blistering and things like that.
So the cryo is just a device that blows cold air at the skin. Cryo cooler, we call them. So they're a nice addition to the clinic. I think we've sort of covered most of these, Kerry, but this is just sort of, going through what questions you might need to ask about the tattoo before you treat it. So we've got sort of working out, is it a professional one? Was it done in the UK? How did your skin react after having the tattoo applied? That can give you a good indication, can't it, as to if they had excessive bleeding at that time,
Yeah.
if there's anything you need to be wary of at all. And also, is it a cover-up? So is there any other ink underneath there that we need to be aware of? Like, is there a white tattoo underneath it? Because if so, you might feel like you're not getting the clearance, but actually what you're doing is oxidizing the white ink that's in the
And
tattoo.
that's another really good thing that's covered in your class. How do you approach treating multiple layers of different colours, and
Yeah.
how to prepare the client? Because if you're treating a black tattoo, there's a red one underneath. The side effects are not going to be the same. How are you going to approach that? So it's really worth, if you're going to be doing tattoo, then it's really worth doing that, so that you know exactly. You don't get someone walking through the door and you think, oh my God, how am I going to approach this?
Yeah. Which leads to one of the questions we have, which is, Kimberly was told never to treat more than 2 palms within one sitting. So 2 sort of these sized areas. What's the maximum time that you will treat for in a single session, Kerry?
I don't, so this is quite not a complicated thing, but it really depends. There's lots of variables on it. So for example, if someone came in with a Celtic band right around their arm, I wouldn't treat all of that in one sitting, but I'd quite happily treat half a sleeve down one side, not round. So, and that again is because of the constriction of the vessels around the, all those kind of things, which again I know is covered in more detail in your class. But if I had, for example, a block forearm of just all black, then I would treat like a zebra crossing effect. So you're treating sort of 20%, you're allowing normal tissue in between the treated areas for, to help recovery. It really depends on what the tattoo is like, how dense it is there shading in between, what their skin type's like, where it is on the body, is it right around the arm? So
Yeah.
I hope that's not going to cause more questions, but
No,
more
it's
confusion
interesting.
rather. But it's not a straight answer, and that's why I would say just try and find out as much as you can about every tattoo, so that when you're presented with a tattoo, I know exactly how I'm going to tackle this.
That's why I think pricing is quite difficult, because we get asked frequently, like, how much would you charge for this tattoo? And it's really tricky because you can't necessarily do it just on the area. So if you looked at this tattoo here, well, you know that you've only got one colour, so you don't need to switch between your different wavelengths. If this were multicoloured, you'd have to have extra time in there just switching between your wavelengths. And also, if you had areas of the tattoo within this that you didn't want to remove, that can be quite tricky as well, can't it? Because you're sort of working around an area. So it can be difficult to say, okay, well, this size of tattoo costs this much, because it's actually more about the makeup of that tattoo, isn't it, in the area? So some people charge by time. So they'll get people and they'll say tattoo removal from, and then a certain price, and then they'll get people in, have a look at it, assess it, and then work out how long you think it's going to take you to treat that, and go from there.
Yeah, I definitely don't recommend doing it by time, only because you have to factor in cooling time as well, and you don't want to be under pressure as well, that someone else is outside and this person's skin is really hot and you haven't got time to cool it down, etc. But I do it by size as a guideline, so up to 5, up to 10 centimeters, etc. But then it's on assessment. So
yeah, good idea.
Also, one of your questions on that slide is, how did you feel straight afterwards? I always ask this question. I've never yet had anyone say, yes, it's happened to me, but very occasionally people can always get flu-like symptoms after having a tattoo. And it's basically their immune system going, what on earth's going on here, kind of thing. If they get those flu-like symptoms rather after having a tattoo, it's highly likely they could get it from tattoo removal. So it's just something to go over with them in the consultation.
Mm. Okay, super.
I love that picture.
It's good, isn't it? So, I mean, people have been interacting, you know, all the way that we've been going through, but we're going to round it up there. So if anyone has any last minute questions, then throw them in the chat and we'll answer a few, and then we'll see where we're up to.
Is that actually real, Hayley? Or was that just for like, it is?
Yeah.
It makes you think though, like, why?
Do you still think why after all these years of treating them? No. I mean,
well, I'm guessing it's probably a joke on his baldness, but yeah, I have seen some hilarious ones, I have to say, in my time.
Yeah.
Yeah, and there's so many different reasons why people come to you. There's some people, you know, people always assume, maybe not clinicians like us, but people, you know, Joe Bloggs always thinks that people who have laser tattoo removal is just someone who got drunk in Ibiza and had a tattoo, but that is so rare. You know, most people, it's old artwork, and it's stuff in the 80s, it's bad artwork, spelling mistakes. You know, I did have a tattooist ring me up once and say he had someone in the chair and he'd done a spelling mistake, and it was he was having Sheila done on his chest, but obviously the guy having it done couldn't see, and I was thinking, oh, is it the I before E and all of that? E before I. No, there was no E in it at all, it was just Sheila. So, but you know, the tattoo artist thought that he could just send him up to me and I could rub it out and he'd go back to the chair and finish. So I think part of our job as well is kind of getting the word out there that yes, laser tattoo removal exists, and yes, we can get amazing results, but it's not a quick fix. So anyway.
So we've got a couple of questions just about the masterclass. So I will email everybody after this with a link to the masterclass page where you can register your interest. It's £75 including VAT. I don't think we've put another date in for June yet, but we probably will. So if you just register for your interest in this one, then what we'll do is the next time we run one, we'll just drop you a line and let you know that we're introducing a new one. But I expect that we'll run them fairly regularly over the next few months. Okay, super. Yeah. Well, I think we'll leave it there, Kerry. Thanks so much for coming on today and sharing your experience with us.
That's okay.
Very sorry about my technical issues earlier on. So.
I'm wondering if I pressed something actually, but yeah, I was just going to say, guys, I cannot recommend it highly enough. I mean, literally all my knowledge is from the stuff I've learned from Lynton over the years, and the qualifications and the master classes and everything. So and they're really fun, they're really good fun. So you know, it's not like being back at school. It's something that we're interested in anyway, but it's just, you leave them feeling like, I just, you know, I've been doing this for a while and I've now learned so much more. Or you don't, you know, you're not doing it yet, and it really empowers you to feel confident that when that person walks through the door, you absolutely know what you're doing and how to get that result for them. So, and it really does give you the edge, you know.
We learn a lot from our users, though. I think that's what makes us quite unique. Obviously, we're a British company. We have quite close relationships with our users, don't we? So, you know, we share information and knowledge. And so it's one thing building machines and selling them. It's another thing that we have our own clinic where we use them. We've been doing it for such a long time. And then we have all you fantastic users out there that will say to us, well, actually, I've been trying this and I've been trying this and this is working. And we learn an awful lot about that. So even if you have done a masterclass, you know, 5 years ago, I would recommend them again, because, you know, in that 5 years, we've learned quite a lot from you guys out there actually using the lasers as well. So we bring that back into the training. So
and these semi-permanent makeups are a perfect example of that, because when I did your masterclass years ago, I wasn't doing it, and it was quite early on in sort of treating semi-permanent makeup, whereas now the masterclass covers that, you know, in a lot of detail. So it's a bit like the core of knowledge. I think at least once every 5 years, I would really recommend doing a masterclass and just keeping your knowledge up. So
yeah. and a good time, obviously, now as well. All right, thank you ever so much, everyone. I will drop you a copy of this presentation so you can rewatch it in your leisure, and have a lovely day, everyone. Hope to see you all soon.
Brilliant.
Thanks.
Thanks, guys.
Bye.
Thanks, Hayley. Bye.
Kerry. Bye.
Bye.